Welcome to the Deep Dive. Today we're getting into something that's, well, fundamental to being human, but often gets shrouded in myth or awkward silence. We're talking about sexual health. Our source for this is a really great conversation with Dr. Malik. She's a board-certified urologist, a sexual health expert on the Diary of a CEO YouTube channel.
Yeah, she really knows her stuff.
Definitely. So our mission here is to kind of sift through the common misconceptions, pull out the surprising facts, and give you some solid information that, matters for your health, your well-being, and your relationships.
Absolutely. And it's amazing how many things we think we know about sex just aren't quite right. Dr. Malik really highlights that gap between belief and reality.
Yeah, it's huge. It goes way beyond just the physical act, doesn't it?
Yeah.
It ties into our emotions, how we feel about ourselves.
Totally.
Okay, so first up, let's tackle a big one.
Right.
How often people are actually having sex? There's this feeling, right, that everyone else is doing it constantly.
Oh, definitely. That comparison trap is so easy to fall into, especially with social media showing these, perfect highlights.
Right. But the reality is different.
Yeah, Dr. Malik points to studies showing that for people in relationships, the average is actually around once a week.
Once a week. Okay.
But the really crucial point she makes, and I think this is so important, is that we shouldn't get hung up on the number. Focusing on that benchmark creates so much pressure.
Yeah, I can see that.
It's the quality of the connection, the pleasure, the intimacy. That's what actually matters for, satisfaction and feeling good in the relationship, not hitting some imaginary quota.
That makes so much sense. It's about the connection, not the scoreboard.
Oh.
Okay, another area where, movies and TV really skew our expectations is sexual response itself.
Oh, absolutely. It's always portrayed as this instant, fireworks every time kind of thing.
Exactly. But normal is, well, different.
Yeah, much more varied.
Wow.
Dr. Malik shared some fascinating physiological details, during arousal, the vagina actually expands, both in length and width, can roughly double in size.
Wow.
And that process takes time, maybe around 18 to 20 minutes on average. Lubrication levels also vary hugely from person to person, time to time.
Right.
And even things like, guys experiencing difficulty getting an erection sometimes, that can be totally normal. That doesn't automatically mean there's a major issue.
That's really good to hear, actually. It normalizes things. And she really stresses communication, doesn't she? Talking openly about sex. Why is that still so difficult for so many people?
Well, part of it is we're just not taught how, right? There's societal awkwardness, maybe some shame left over from how we were raised. So Dr. Malik has some really practical tips, have the conversation outside the bedroom in a neutral space.
Okay.
Use I statements, I feel, I'd like, instead of blaming you never, that kind of thing.
Yeah, that just puts people on the defensive.
Exactly. And recognize these talks can be emotionally charged. Sometimes, getting help from a sex therapist can make a huge difference in learning how to navigate it.
That sounds like really solid advice.
Yeah.
Okay, let's switch gears a bit. Pelvic floor. I, like many people, I think, mostly associate that with, bladder control, maybe after having kids.
It's super common. But the pelvic floor, it's this whole kind of hammock or bowl of muscles at the base of your pelvis. It does so much more.
Oh, yeah.
Yeah, it supports your organs, helps with stability, bowel and bladder function, obviously, but also really crucial for sexual function, orgasm even.
Interesting. And men have them too, right? That's often overlooked.
Absolutely. Men have pelvic floors, and they're just as important.
So what happens if those muscles aren't working right? If there's dysfunction?
Well, it can go two ways. They can be too weak or they can be too tight. Both cause problems.
Like what kind of problems?
Things like incontinence, leaking urine, constipation, pain with urination, pain with erection or ejaculation for men, even urinary frequency or urgency, like feeling you have to go all the time.
Wow, that's a lot. So what can we actually do? How do we keep them healthy?
Right.
Strengthening them.
Pelvic floor exercises are key. Kegels, most people know them as. It's that squeeze and lift, like trying to stop the flow of urine midstream.
Okay.
Or Dr. Malik had a couple other cues, like for men, trying to lift the penis without hands, or like you're holding in gas.
Right.
But the relaxation part is just as important as the squeeze. You have to fully let go after each contraction.
Squeeze and release. Got it.
And interestingly, orgasm itself is an involuntary pelvic floor workout.
Huh. Good to know. Are there things we do that might mess them up?
Well, one big one is prolonged sitting. Just sitting for hours and hours can create tension in those muscles and affect blood flow down there.
Wow.
And that lack of blood flow over time could potentially contribute to issues like erectile dysfunction in some men. So getting up, moving around, it matters for this too.
Good reminder for all of us desk workers. Okay, now, here's something that really stood out from Dr. Malik's insights. The link between sexual health and, well, our overall health, especially heart health.
Yes, this is huge. She makes a really strong case that doctors should be asking about sexual function routinely.
Why is that?
Because problems, especially things like erectile dysfunction, can actually be an early warning sign for other issues, like heart disease.
Really? How does that work?
Well, think about it. The arteries supplying blood to the penis are much smaller than the ones going to the heart.
Okay.
So if there are problems with blood flow, like blockages starting to form, they might show up in those smaller vessels first, causing erection difficulties, sometimes years before a major cardiac event.
Wow. That's actually a crucial connection. Makes you wonder why it's not standard practice in checkups.
Exactly her point. Often, doctors don't ask about orgasm or pleasure or satisfaction. It's a missed opportunity, really, for understanding the whole picture of someone's health.
It's definitely food for thought. Let's talk about desire. This can be tricky territory in relationships, right? How it changes or differs between partners.
Yeah, absolutely. Dr. Malik breaks it down into two main types. There's spontaneous desire. That's the kind that seems to just pop up, maybe more common for men initially anyway.
Right, the out-of-the-blue feeling.
Exactly. And then there's responsive desire. This is more common, especially for women in longer-term relationships. It doesn't mean something's wrong. It just means desire often arises in response to intimacy or closeness rather than preceding it.
Ah, okay. So not feeling that spontaneous urge all the time doesn't mean you're broken or the relationship is doomed.
Precisely. Both types are completely normal. It's a huge misconception that you have to have that spontaneous jump your partner feeling for things to be okay.
That's actually really reassuring. So for couples where maybe one has more spontaneous and one more responsive desire, what's the advice?
Her practical tip is to schedule time for intimacy. And she uses the word intimacy broadly. Could be cuddling, talking, massage, just connecting physically and emotionally.
Not necessarily scheduling sex itself.
Right. Take the pressure off intercourse being the only goal. Focus on connection, and often desire will follow from that closeness for the person with responsive desire.
That makes a lot of sense. A gentler approach. Okay, hormones. They run so much of the show. What's the lowdown on hormones and desire?
Well, testosterone is the big one for desire, and this surprises a lot of people, but it's key for both men and women.
Even women?
Yep. Women actually have more testosterone than estrogen circulating in their bodies. It's crucial for libido in women, too.
Huh. Didn't know that.
Other hormones matter, too, like thyroid hormones, prolactin, and a big factor is stress.
Oh, stress, of course.
Yeah, high levels of cortisol, the stress hormone, actively suppress testosterone production, so chronic stress can really tank your desire.
Okay, so if someone's feeling low desire, maybe low energy, thinks testosterone might be involved, are there natural things to try first?
Definitely. Dr. Malik emphasizes lifestyle factors. Number 1, sleep. Getting enough quality sleep, like 7-8 hours, is huge for hormone balance. Then resistance exercise, lifting weights, particularly working the big muscles in the lower body. And diet plays a role. A Mediterranean-style diet with plenty of healthy fats is important because hormones are made from fat.
Good basics. What about testosterone therapy, like injections?
She advises caution there. It's not a magic bullet for everyone. It really depends on your actual levels, and just adding more isn't always better and can even be risky. Needs proper medical evaluation.
Got it. Okay, something else concerning Dr. Malik brought up is the trend of declining sperm count and quality.
Yeah, this is pretty alarming, actually. Over the last 50 years or so, studies show sperm counts have dropped significantly, maybe by almost half. Quality metrics, too.
Wow. Why is that happening?
It's likely multifactorial. More sedentary lifestyles, rising rates of metabolic issues like obesity and diabetes. And environmental factors are a big suspect, too. Things like microplastics, endocrine-disrupting chemicals found in plastics, pesticides.
So practical advice there.
She suggests simple things like trying to reduce plastic use, maybe switching from plastic water bottles, definitely not heating food in plastic containers where chemicals can leach out.
Small changes, but potentially impactful. And this isn't just about fertility, is it?
No, that's the other point. Sperm health can actually be a reflection of a man's overall health. So this trend is worrying on a broader level, too.
Yeah, definitely. Okay, slightly different angle. Semen volume anything guys can do to increase that?
The biggest factor, according to Dr. Malik, is simply how long it's been since the last ejaculation. More time equals more volume generally.
Makes sense.
Hydration also plays a part, so drinking enough water is good.
Hmm.
And interestingly, the force of ejaculation can decrease with age, which is related to pelvic floor strength.
Ah, back to the pelvic floor.
Yep. So doing those exercises can potentially help with the force aspect.
Okay, now technology. Phones, laptops, any real impact on the testicles or sperm? There are lots of myths.
Right. The idea that the Wi-Fi or Bluetooth signals themselves are directly harmful to sperm, the evidence for that isn't very strong.
Okay.
But the heat generated by these devices is a potential issue. Laptops directly on the lap, phones tucked in the front pocket for hours that can raise the temperature of the scrotum.
And that's bad for sperm.
Yes.
Yeah.
Testicles need to be slightly cooler than core body temperature for optimal sperm production. So chronic overheating isn't ideal.
So the advice is?
Keep phones in a back pocket or chest pocket if possible. Use a lap desk or table for laptops, especially if you're trying to conceive. It's mainly about managing the heat.
Simple enough. Okay, let's tackle masturbation. Lots of myths, lots of baggage around this topic.
Yeah, huge amount.
Testosterone levels, does masturbation lower them? That's a common one.
Dr. Malik says there's really no good evidence for that. There was one small study people point to about abstinence slightly raising T levels after 21 days, but it was temporary and minor. Overall, no significant long-term impact either way from masturbation or abstinence.
Okay, myth busted. When does it become too much?
It's really about function, right? Is it interfering with work, relationships, responsibilities? Is it creating a dependence or addiction? That's when it becomes problematic.
Makes sense.
Another potential issue is habituation. If someone gets used to very specific, maybe intense stimuli during masturbation, sometimes that can make it harder to get aroused or climax with a partner using different stimulation.
Right, kind of calibrating to one specific thing.
Exactly. And just to be clear, does not cause blindness.
Huh. Good to confirm.
Yeah.
What about things like No Nut November? Any actual health benefit?
No proven benefit, according to Dr. Malik. It can actually just cause stress for some people. Plus, nocturnal emissions, wet dreams are totally normal, so the body has its own release mechanism anyway.
So forcing abstinence doesn't really achieve anything biologically profound?
Pretty much. Same goes for athletes thinking semen retention boosts performance. No science behind that.
Okay, what about post-nut clarity? That feeling some people get after orgasm. Is that real?
Yeah, there's a biological basis. After orgasm, hormones shift. Prolactin goes up, dopamine goes down. That combo can lead to a temporary decrease in desire, maybe feeling more detached or sleepy.
Ah, hormones again.
Yep. It varies between people how strongly they feel it. There are some evolutionary theories about why it might happen, maybe shifting focus after potential reproduction, but it's complex.
Interesting. Now here's a surprising one. A potential link between ejaculation frequency and prostate cancer.
Yeah, Dr. Malik mentioned a study, an observational one, so it shows correlation, not causation, that suggested men ejaculating 21 or more times a month had a lower risk of prostate cancer.
21 times. Wow. What's the theory?
It's sometimes called the prostate stagnation hypothesis. The idea is that frequent ejaculation helps clear out fluids and potentially harmful substances from the prostate gland.
But it's not like a prescription, right? Ejaculate 21 times for health.
Definitely not. It's just one study finding, and lots of other lifestyle factors impact prostate cancer risk. But it's an interesting correlation.
For sure. Okay, let's talk about pornography. Huge topic, often very polarized.
Yeah.
Is it just bad?
Dr. Malik takes a more nuanced view. She doesn't see porn itself as inherently bad. It's a form of entertainment, and moral judgments are personal.
But there are concerns.
Oh, definitely. Big concerns, especially around children's access. Young brains might struggle to differentiate the often unrealistic portrayals from reality.
Right. And addiction potential.
Yes, because it triggers a big dopamine release, it can become addictive for some, and it can absolutely contribute to unrealistic expectations about what sex looks like, how bodies should look, performance.
Yeah, setting people up for disappointment or anxiety in real life.
Exactly. But for adults, she also acknowledges it can be a source of pleasure, exploring fantasies, even something couples watch together sometimes.
And the future? VR porn.
That adds another layer. Potential for even more immersive experiences, which raises questions about impact on real-world intimacy. But she also notes potential positive uses for VR tech in therapy, like helping people work through sexual trauma.
Complex issue. And that brings us to trauma. How does past trauma, emotional or physical, connect to sexual health?
It's a massive connection, Dr. Malik stresses. Trauma, even from years ago, can absolutely show up physically. It can manifest as pelvic floor dysfunction, that tightness we talked about, pain and difficulty with arousal or orgasm.
The mind-body connection is really strong there.
Incredibly strong. Psychological well-being is fundamental to sexual health. That's why therapy to address and process trauma is often so vital if someone's experiencing sexual difficulties. She basically says everyone with sexual dysfunction has a psychological component that needs addressing.
That really highlights the need for holistic care
Yeah.
and better education, she mentioned.
Yeah, she advocates for schools covering not just the biology, but also consent, healthy relationships, the impact of trauma, and even digital literacy around things like
It
porn.
makes total sense. Okay, quick clarification on pregnancy.
Yeah.
Sex during pregnancy, safe or not?
Generally, absolutely safe. That's a persistent myth that it's harmful. In a normal, uncomplicated pregnancy, Dr. Malik says sex doesn't cause preterm labor, doesn't harm the fetus. Unless a doctor advises otherwise for a specific medical reason, it's fine.
Good to clear that one up. Now let's focus on female pleasure. The clitoris often misunderstood, maybe underappreciated.
Yeah.
What's key to know?
Well, first, it develops from the same tissue as the penis in the fetus, so it's equally packed with nerve endings, highly sensitive.
Equivalent, essentially.
Pretty much.
Yeah, right.
And what you see externally is just the glands. The structure extends internally quite deep into the pelvis.
Right.
And crucially, for most women, Dr. Malik cites around 85% direct clitoral stimulation is the most reliable way to achieve orgasm.
So penetration alone often isn't enough.
Often no, which is why communication and exploration are so important, finding out what kind of touch, pressure, rhythm works for that individual person.
Are there other important areas, like the G-spot?
Yes, she mentions the G-spot, an area on the front wall of the vagina, and also the cervix, which can be sensitive for some women, possibly via different nerve pathways like the vagus nerve. Stimulating multiple zones can often enhance the experience.
So it's not just one spot, but a whole landscape.
Exactly.
And the orgasm itself, it's not just flipping a switch, is it? Describe that build-up and peak.
Right, definitely not a switch. She describes it as reaching a peak of tension, followed by a release. Intense pleasure, often a feeling of losing conscious thought for a moment. It can last from, say, 5 seconds up to a minute.
And getting there?
Requires stimulation building over time. Rhythm is often really important, finding a consistent pattern that works. Physiologically, heart rate goes up, pupils dilate, muscles all over the body contract. Sometimes sounds happen involuntarily.
Like climbing a mountain, she said.
Yeah, or like inflating a balloon that has a tiny leak.
Yeah.
You need that steady input, that rhythm, to get it fully inflated before the release.
Great analogy.
Mm.
Okay, pulling this together, practical tips for enhancing female pleasure.
Number one is communication, asking, listening, understanding preferences. Prioritize clitoral stimulation, find out what feels good. Lubricant. Super important for comfort and enhancing sensation.
Don't skip the lube.
Definitely not. Scheduling that intimacy time we talked about, taking the pressure off, and mindfulness, really being present in the moment, focusing on sensations.
Those all sound really actionable.
Okay.
Time perception during sex. Does it match reality?
Often not. People tend to think sex lasts longer than it actually does.
Oh yeah. What are the numbers?
Dr. Malik mentions studies showing the average time from starting penetration to male ejaculation is somewhere around 5 to 6 minutes. 5.1 to 5.7, something like that. Varies a bit.
Okay, 5 or 6 minutes on average. But what do people want it to last?
That's where it gets interesting. Studies asking about ideal duration often show women preferring longer, maybe 18 to 25 minutes of intercourse, while men's ideal might be closer to 12 minutes.
So there's a gap between average and maybe desired length.
Yeah, but again, the takeaway shouldn't be fixating on the clock. It's about mutual satisfaction, connection, pleasure, however long that takes for the people involved, not some arbitrary number.
Quality over quantity again. Okay, sizes. This causes so much anxiety. Vagina size first. Does having more sex make it looser?
That's a total myth. Dr. Malik debunks that completely. Any feeling of looseness is about pelvic floor muscle tone, which can be affected by childbirth, age, overall fitness, not the number of times someone has had intercourse. Orgasm actually strengthens those muscles.
Got it. Okay, penis size. Does it correlate with shoe size, hand size?
Nope. Another myth, mostly. She mentioned one Japanese study finding a weak link to nose length. Bizarrely, but generally, no reliable connection to other body parts.
What is the average size then?
Erect average is around 5.1 to 5.3 inches in length. The perceived ideal, often thanks to porn, is bigger, maybe closer to 6 inches.
And what do women actually prefer?
Studies looking at things like sex toy preferences or desired size for neophalluses and trans men actually suggest preferences tend to cluster around the average length and maybe slightly above average girth,
Yeah.
not necessarily huge.
Interesting. So the obsession might be misplaced?
Largely, yes. Especially since, as we said, clitoral stimulation is usually key for female orgasm, not penis size itself. Societal pressure plays a huge role in the anxiety around it. There are even products, like the O-Nut she mentioned, designed to make penetration less deep for comfort.
Right. Does penis size change with age? Shrink.
Generally not if someone is healthy. However, significant weight gain can make it look shorter because of fat at the base. And underlying health conditions that affect blood flow, like heart disease or diabetes, can sometimes lead to actual tissue changes and a bit of shortening over time. Nighttime erections are a good sign of healthy blood flow, by the way.
Okay. Can anything actually increase size safely?
The only method with some evidence, Dr. Malik says, is traction devices consistently using them over a long period might lead to modest gains, maybe half an inch or so. Pumps give temporary effects, but not lasting change. Surgeries are risky and often don't work well.
So mostly you work with what you've got.
Pretty much. Interestingly, she mentioned some recent studies hinting that average penis length might actually be increasing slightly over the last few decades, maybe linked to earlier puberty.
Huh. And is there a natural correlation between penis and vagina size?
Roughly, yes. The average flaccid penis length isn't wildly different from the average resting vaginal depth, and the average erect length matches reasonably well with the average aroused vaginal length. The body tends to accommodate.
Okay, that's reassuring too. Let's touch on labia and labiaplasty.
Right, labiaplasty is surgery to reduce the size of the inner labia, the labia minora. Sometimes it's for comfort if they cause chafing, but often it's cosmetic.
And the drive for that is?
Dr. Malik points out there's huge natural variation in labia size, shape, color, symmetry. It's all normal. But the rise in labiaplasty seems largely driven by cosmetic ideals, often influenced by porn where visible labia are sometimes digitally removed or less common.
So the message is diversity is normal.
Absolutely. There's no single right way for labia to look.
Okay, final topic.
Yeah.
Female ejaculation or squirting. What actually is that?
Dr. Malik breaks down vaginal fluids into maybe 3 types. There's lubrication, which happens during arousal. There's female ejaculate, usually a smaller amount of milky fluid from the Skene's glands near the urethra glands, analogous to the male prostate.
Okay.
And then there's squirting, which is typically a larger volume of clear fluid expelled from the urethra during orgasm.
Is it urine?
That's the debate. Studies analyzing the fluid have found PSA, which the Skene's glands produce, but also components suggesting it's basically diluted urine.
But women who experience it often say it doesn't feel like peeing.
Exactly. So the mystery isn't totally solved. Maybe it involves water being absorbed and then expelled, some theories suggest. It's still being researched.
So not something partners should necessarily be trying to make happen.
Right. It's not a goal to aim for or a sign of better sex. It happens for some, not for others. And that's okay.
Fascinating. Wow, we have covered so much ground. Huge thanks to Dr. Rena Malik's insights that formed the basis for this. What's the main takeaway we want people listening to have?
I think the biggest thing is just sexual health is health. It's integral to our overall well-being. It deserves attention. It deserves open conversation. It's not something to be embarrassed about or push aside.
Couldn't agree more. Well, thank you for joining us on this deep dive. We really hope this conversation has shed some light, busted some myths, and maybe makes it a little easier to talk about these things in your own lives.
And maybe a final thought to leave people with, something Dr. Malik said that really resonated. For women especially, she believes the choice of partner is one of the most critical decisions impacting their emotional health, their sexual well-being, and even their overall success in life.
Wow, that's powerful. Really emphasizes the depth and importance of our connections. Something to think about.